You're listening to the Bird Dog Babe podcast with my mom, Courtney Bastion.
What we know about the brain, a healthy brain, it uses glucose as an energy source. As our pets age, truly by the age of 6, glucose metabolism, so the ability to utilize this energy source to help energize the brain cells, also known as astrocytes, already going down for these dogs at age 6, and they're not even showing this externally yet. So having a senior formula that is going to focus, right, on the improvement of overall cognitive health is going to be paramount for these senior guys.
Hey bird dog babes, my name is Courtney Bastion and I am obsessed with all things bird dogs. And I'm here with you to share the stories, experiences, knowledge, and opinions from the women and a few guys in the industry that are killing it. I'm a Wisconsin girl living in a Montana world. I'm mom and 2 incredible kiddos, wife and occasional assistant to a pro gun dog trainer, traveling the U.S. talking about canine nutrition while hunting, breeding, and competing with my German wire hair pointers and Bronco Italianos. As someone who started hunting later in life because I wanted to give my dogs the opportunity to do what they were bred to do, I'm here to help inspire, educate, and connect women to get their bird dogs out in the field and experience a bond like no other. So pour yourself a glass of wine and get ready to be challenged and encouraged while you learn. This is the Bird Dog Babe podcast. My guest today is Dr. Callie Harris. Dr. Callie is a Veterinary Communications Manager for Nestle Purina PetCare. I asked Dr. Callie to come on the podcast and talk to us about nutrition for our senior dogs. Our bird dogs give us so much throughout their lifetime, and we owe it to them to provide the very best in their aging years. Imagine a dog food that can help make your dog feel and act young again. The stories I hear from people that feed their dogs Purina Pro Plan Bright Mind are seriously mind-blowing. They start playing with their toys and housemates again, pulling at their owner's pants legs and barking in excitement. It's heartbreaking for us to see the signs of old age setting in our dogs, but it's pretty damn amazing to see the spark of life come back from a simple change of diet. Dr. Callie breaks down the magic of the Bright Mind formula and discusses other options for our aging dogs in this episode. I have a couple coupons for a large bag of Purina Pro Plan. Watch my Instagram page at The Bird Dog Babe this week and find out how to win one. Okay, let's get after it. Thank you to sponsor Dakota 283. Unparalleled protection for traveling to and from your favorite hunting spot. Dakota 283 kennels are a premium quality roto-mold with recessed handles on top for convenient and safe tie-down and makes it easy to lift up into the truck. I love the secure door frame with high security locks so I know my dogs are safe when I need to stop for fuel. An added bonus is the drain hole in the back, which makes cleaning a breeze when your dog has been run hard and put away wet. Head over to Dakota283.com and use promo code BIRDDOGBABE for a 10% discount. Thanks to sponsor Excel Shooting Sports, elite dealer of Caesar Guarini, Fab Arm, and Siren shotguns. Siren is the world's only full line of shotguns created for the female competitor, hunter, and shotgun enthusiast. Excel is one of only 4 demo centers west of the Mississippi. They give you the opportunity to actually try out a gun before you walk out the door with it. As an elite dealer for Caesar Guarini, Excel offers their customers unlimited pit stops of free service and tune-ups on all shotguns, a great way to have your gun in top condition for the upcoming hunting or target season. In addition, they're offering an exclusive deal to all of the Bird Dog Babe listeners for a free gun slip with each purchase, a $90 value. Good morning, Dr. Callie Harris. How you doing?
Good morning. I'm doing so well. How are you?
I am fantastic. I am so excited to talk about this topic today because I love the old dogs and
Yes.
I love this formula.
Yes, yes. Me
too.
I'm an old dog lover as well. So excited to talk to you today.
Awesome. So tell us who you are and what your position is at with Purina.
Yeah, perfect. So my name is Dr. Callie, and my position with Purina, I am called a Veterinary Communications Manager, which basically means I love spreading the good news, the good word about all of Purina, the products, the science, the innovations, and everything beyond that. I've been with the company for almost 4 years, which is crazy because time is flying. But prior to working with Purina, I practiced as an emergency vet, and I still provide relief services down here in my hometown of Atlanta. So I love dabbling still with clinical work, love supporting Purina. So it's just been a really great opportunity.
That's awesome. They're an incredible company for sure.
Yes.
Before we dive into today's topic, I just wanted to touch on for general listeners to get an idea when they are looking for food, because when we go into a store, when we're looking online, there are so many different options. And I think now consumers are all a little bit more cognizant of what was going on with the DCM issues and such. Mm-hmm. So can you just briefly touch on the importance of when we're seeing these things on the bag of USDA, FDA, WSAVA, and AFCO? Yes. How important is that? Which ones should we be looking for, and what do they mean?
Yeah, it can be so confusing, and I'm so happy, that your listeners, as well as my clients, the pet loving community, are becoming more aware and investigating a bit more with the food that they are feeding their pets. And so you brought up some really good entities, and so let me help kind of identify and differentiate for you. So the USDA, most of us have heard of the USDA, the United States Department of Agriculture. They're responsible for ensuring that pet foods are labeled so they're not mistaken for human foods, right? So makes sense. Like, let's just make sure that this are for pets and then human foods are for humans, right? They also help inspect and regulate animal research facilities, which are really important, especially if you're talking about reputable food companies that are providing the science, behind the products. You want to make sure that these research facilities that are owned and operated in the U.S. by these pet food companies, they have to fulfill USDA requirements. Now, the FDA, which is Food Drug Administration, they are what I would consider the bread and butter as far as the regulation of pet food. So they're going to require that all foods be safe, produced under sanitary conditions, contain no harmful substances, and be truthfully labeled, which is huge, within the pet loving community. They also put forth some labeling requirements, which makes it easier for your listeners, for my pet parents, for my clients to understand what's in that actual bag of food and how to reach out to the companies to determine what's in that actual bag of food. AFCO, you mentioned, which is the Association of American Feed Control Officials. Think of them more as an advisory board that helps to establish nutrient profiles and labeling guidelines and defines ingredients, what's a byproduct, right? What, is considered animal digest, things like that. And then they're also responsible with putting forth feeding trial protocols. So when I'm in my exam room talking to my clients, a great place to start when making a decision about what pet food to provide for their pets is, does it have the AFCO nutritional adequacy statement on the back of the bag or the back of the can? Because based on that AFCO statement, either based upon a written nutrient profile or feeding trials, it's going to help our listeners understand if that diet is complete and balanced and what is the appropriate life stage to feed that product. So that is probably the most important information that your listeners, that my clients can find on the back of the bag. Lastly, you had mentioned WSAVA. And so WSAVA, which is known as the World Small Animal Veterinary Association, think of them as a global community comprised of more than 200,000 veterinarians. And their main goal is the advancement of companion animal welfare. But in relation to nutrition, they have a whole committee called the Global Nutrition Committee, which helps to develop nutrition guidelines. And so I want to point out that they certainly have a fantastic toolkit that's available online that provides my clients, your listeners, on recommendations on how to select pet food for their pets. And just so you know, maybe you were already aware of this, Purina Pro Plan meets the WASAVA guidelines. So it's fantastic.
Right. Thank you so much for touching on that, because it is a confusing thing. And I think the importance of these, knowing what's regulated and knowing what's in the food, is very, very important when we're making decisions on what we're putting into our dogs. So.
That's a misconception. I feel like a lot of my clients are concerned that the pet food industry is not regulated. And so with all of those entities that come into play, like the FDA, the USDA, AFCO, we all should feel more comfortable and more confident, for sure.
Right, right. And I think I had learned too, or heard, that dog food is, if you go into a grocery store, dog food is more regulated than almost anything in that store, except for baby food.
Yes, it's on the same, I was going to mention that. It is on the same level as infant formula. You know, you think about, okay, how serious it is to make sure that what we're giving our newborn babies, our infants, is going to be safe and effective, not do any harm. Well, that is the same level of quality assurance that's placed on pet food. So there have been times when I've often wondered if maybe we should all be eating pet food, but there's so much emphasis and investment, you know, that goes into ensuring that it's safe and of high quality.
Yeah. Well, when my kids were smaller and they were starting to crawl around, they sure did enjoy digging in my senior girl's Bright Mind formula. And I thought, well, it can't be doing any damage.
That's right. You know that it's safe.
I did.
With high quality ingredients.
Yep. And getting those MCTs in, I was like,
there we go.
I'm going to have some
early.
bright children.
That's right.
Go ahead. Oh, that's terrible. Okay. But so, yeah, touching on that, let's get into one of my favorite formulas, the Pro Plan Bright Mind.
Yeah, it's one of my favorites too, Courtney. Honestly, before I started Purina, this was actually a diet that I had learned about and actually spoke on behalf. So before I became a Purina employee, I was a Purina veterinary ambassador, which basically means that I had a great relationship with Purina, still out in practice. And so they would utilize me to come and speak on their behalf at certain events. And this was one of the first events that I participated in back in 2015, I believe, where I talked about Pro Plan's Bright Mind 7+. So it is a great diet.
Mm-hmm. Yep. And I think I first learned about it at Westminster. Gosh, I don't remember. The marketing team was there. It was the first year it had just come out. And our girl had just turned that 7 years old. And I took it home and started her on the formula because it was just she's a senior dog. This is a senior formula. I love Pro Plan. Yep. And I have to tell you a personal story on why I love this food so much is when she was our first wire hair. When she turned 2 years old, she was having a seizure once every about 6 months.
Wow.
So, yeah. So not enough to, be medicated for it.
Sure.
But it was just something we were aware of.
You had to keep your eyes out for it for anymore.
Right.
Yeah.
Right. And so after we started her on this food, it was the only thing that had changed in her lifestyle. And she didn't have a seizure, and we could get into this later. It's not that it's by any means a cure-all, but for her, I think the low, I don't know what you would call it, but that she didn't have it, frequent ones or
she
terribly
wasn't super severe yet, and the frequency was reduced. So got it.
Exactly. Yep. And this was the only thing that ever changed in her life. And so she was able to go those final 7 years without a seizure for whatever means and purposes I didn't know, but all it was a formula change. And for me, when I talk to people about Purina Pro Plan in general, I say, if you have a senior dog and you've never tried any of our formulas before, try the Bright Mind.
Right.
It is life-changing for your dog.
Right.
And it'll show you the innovation that Purina has, the studies they do. I just think it's the most amazing. It shows you everything about the company. So I'm sorry, without further ado, but that's my story, and that's why I love it.
I love hearing those stories, and we all have very similar stories, even from the vet side of things. And I think it's very interesting how life-changing that an over-the-counter diet like Bright Mind 7 Plus can truly be. So
you're exactly right.
Always happy to hear that.
Yeah. The stories we hear are just absolutely incredible. And when you think that food that you're feeding your dog can change and improve their life so much for the better is truly an incredible thing.
Absolutely.
So tell us why a specific formula for senior dogs? Why is that important?
Oh my goodness. So when I do my senior pet exams, right, and specifically with senior dogs, what I always want to make sure that my clients walk away understanding is that there's not going to be just one type of senior formula that's going to be a catch-all for all of our senior pets, right? Because as dogs become seniors, there's going to be certain age-related changes where nutritional intervention can truly be helpful or impactful, but these changes can vary. They can be related to their joints, can be related to their weight, whether it's weight gain, weight loss, muscle mass loss. It could be something going on with them as they age that would be more systemic, metabolic, endocrine related. And so I say that, you have to really utilize your veterinarian to ensure that whatever diet that you're making a decision to put your pet on, the senior category, is specifically targeted and appropriate for that particular pet. Now, with that being said, a couple of things that we can all expect with our aging dogs is that they're, number one, they are likely to require higher amounts of dietary protein, okay? And the reason for that is that we have to make sure we're adjusting to their normal muscle mass loss, muscle mass wasting that's going to take place as they get older. Also, too, a lot of people don't consider this, but as our pets age, they may have a decrease in their overall food consumption. So if they're not eating as much as they used to when they were romping around as a 2-year-old, then you could imagine if you don't change that formula into something that's going to be a bit higher or more optimal in that protein level, then they're not going to get as much protein in their food. So that's why we have to make sure we target that. And then also brain glucose metabolism is going to decrease, which is really where we're going to spend some time talking today, because what we know about the brain, a healthy brain, it uses glucose as an energy source. As our pets age, truly by the age of 6, glucose metabolism, so the ability to utilize this energy source to help energize the brain cells, also known as astrocytes, already going down for these dogs at age 6, and they're not even showing this externally yet. So having a senior formula that is going to focus, right, on the improvement of overall cognitive health is going to be paramount for these senior guys.
You were just kind of talking about that with the glucose. So what kind of research went into creating this formula?
Yeah. So Bright Mind 7 Plus had quite a bit of studies that took place before this diet even hit the market. But the landmark study that I want to share with you truly wanted to evaluate the effects of this nutritional supplementation of MCTs, also known as medium chain triglycerides, and the impact that it was going to have on the healthy aging brain. Now, it's important for me to point out when I say healthy aging brain, because there's going to be a counter to that. There's going to be some seniors that are diagnosed with a dysfunction or a syndrome called cognitive dysfunction syndrome, which we'll talk about a little bit later. But with the senior guys in this particular study, they were otherwise healthy. they were just getting older. So in the study, it was about 24 beagles between the ages of 7 to 12, and they were randomly split up, about 10 males, 14 females. And ultimately, during this 8-month study, they wanted to compare the impact of the ones who were fed a complete and balanced diet with the addition of MCTs, medium chain triglycerides added to it, versus the ones who were just on a complete and balanced diet. They all went through a series of cognitive assessments. And so basically wanting to look at their learning ability, how they reacted or were able to locate objects in a space, how they responded to odd objects, and really just to gather where they were or evaluate where they were from a cognitive health standpoint. The ones that were fed the MCTs, medium chain triglycerides, they all performed better. And so improvements in mental sharpness and just overall attention, these were the visible results that were seen with those guys that were placed on the diet that contained the MCTs versus the ones who did not have the MCTs added. So really interesting stuff.
Would there be any benefit to dogs having the MCTs at an earlier period in their life instead of before they're aging?
Yeah, so that's a great question. So here's typically what happens. Usually around age 6, okay, in a dog's life is typically when you're going to start to see a decrease in the utilization of glucose as that primary energy source for the brain. Up to that point, they're fine. They're using glucose effectively. Glucose is able to cross that blood-brain barrier a bit more easily. And so the need to add in MCTs, which then are converted into ketone bodies, which is what is actually supplying that energy for the brain, the need for that is really not necessary because they're not having any difficulties metabolizing glucose. But by age 6 and higher, that is when you're going to see a reduction in it. And so I wouldn't say adding in MCTs any earlier would be beneficial for this particular type of impact that we're trying to make. But certainly by the time they turn age 6, age 7, it's definitely something we want to start considering.
Okay. Interesting. And is that, I get a lot of people ask me the question of, well, can I just add coconut oil to my dog's food?
I love this question.
Yeah. And will it just do the same thing?
Yeah. And it's a fair question. It's a fair question because what that tells me is that the people who are asking you this question, my clients, they are reading and they are learning where MCTs can be found, right? And so coconut oil can be a source for medium chain triglycerides, but here's where it differs. So first of all, in Bright Mind 7 Plus that contains the medium chain triglycerides, it's a very specific purified source of it, all right? And so it's going to be composed of very specific carbon atoms on this shorter chain fatty acid that has been shown to be impactful for overall cognitive health. And so yes, coconut oil may contain medium chain triglycerides, which is just, again, your short chain fatty acid or a non-traditional source of fat, but we can't be sure that it's going to contain those specific carbon atoms that show impact. Plus, when I have had clients that are trying to dose coconut oil on their own, by just adding it to the food, it can get really tricky. Many of my clients tend to give too much of it, which then can cause GI disturbance, so causing diarrhea, some nausea, some vomiting. So you really want to stick with a formula like Bright Mind 7 Plus that has, first of all, the appropriate amount of the MCTs in it, as well as the specific carbon atoms that are going to be beneficial.
Okay. And I think we can get into supplementing food in a totally different podcast.
Right. Yeah. But that's a whole nother conversation.
Right. But I mean, when you're talking earlier about complete and balanced diets, if we start adding in, something like, let's say, coconut oil, is that going to put off that balance of our diets?
It can, because here's the thing. So with a company like Purina, they have, obviously your food scientists, your researchers, all the people with all of the accolades and the awards and, all the doctors, right, that are creating these formulas, they have put a lot of investment and investigation into making sure that the nutrients are in the appropriate composition, the appropriate amounts that would be considered complete and balanced based upon the life stage that you're feeding. And so from an external standpoint, myself included, as a pet parent, if I start kind of making my own decisions by adding different things to the food, it can certainly throw off the taste, which is important from a palatability standpoint and creating food aversions. It can certainly be too much of a nutrient, like what we were just talking about by adding coconut oil, that's maybe more fat than what our pets can tolerate. And so you absolutely do run into the risk of having some adverse signs or effects that you really just don't want to deal with.
Right. And Dr. Callie, can you tell me, I thought I've heard along the way that this, the research that was done with this formula was being used in human Alzheimer research as well. Do you know anything about that?
So it's kind of a two-way street. I know that with a lot of studies that we do on the veterinary side or in the pet food side, we are looking at studies that were done previously on humans. And so there has been a lot of great information that has come out on Alzheimer's or dementia and the utilization of MCTs. And so we have taken information from that. And then as a result, we've also been able to provide information for our human study counterparts as well. So it's definitely a two-way street with that.
Okay. And I got to tell you, because my grandma has been suffering from Alzheimer's for several years now. Mm-hmm. And so I've been putting MCTs in my coffee every morning, thinking that's going to help be a preventative of some sorts, but am I just kind of wasting my time on that and just tasting my coffee due to it?
Well, there are certain recipes out there too. Like I have actually a teammate that has a recipe for MCT cookies. And so just where you're able to add these medium chain triglycerides, but you still have to be careful with the sourcing of it. Even with the recipes that are out there, you want to make sure that it's truly going to contain the carbon atoms or the purified form, right? That's going to be impactful. So for you and your coffee, I don't think it's hurting anything per se.
Okay. Well, and I think I've even tried a cookie recipe a couple years back. But they're not, MCTs in general, they're not delicious.
No. Yes, we were just talking about this within the vet group actually yesterday, that MCTs can be a little bit tricky when it comes to palatability. And so that's another reason why it's so important, if you're wanting to add this or supplement or try to provide this for your pet, that you're doing it in a formula like Bright Mind 7 Plus, where you have, the experts that have been able to add in other palatable ingredients, make sure that it's the appropriate amount of the MCTs that aren't going to throw off the taste. So there's a bit of a balancing act with that, but you are correct. Just MCTs on their own, certainly not what we would consider a delicacy.
Right. Well, and with Bright Mind, I feel when we have people come to us that say they have their dog isn't eating if they're, at an event, and there's some added stress, and we'll tell them just to try the Bright Mind, and they gobble it right up. It's almost like there's an appetite enhancer in it or something, because dogs really do love this formula.
They do. They really do. There's some great other ingredients. Like, first of all, besides just the MCTs and Bright Mind 7 Plus, you have to recall that there's, other nutrients. So it's a higher amount of protein, because Bright Mind 7 Plus is considered a senior formula. And just like I mentioned before, as our dogs age, their protein metabolism is going to go down. Food consumption can potentially go down. So we needed to add a bit more protein, or an optimal amount of protein into a senior formula. So that actually is going to aid in palatability as well. Plus there's some other brain supporting nutrients in Bright Mind 7 Plus that are beneficial to these guys. So we're talking about certain vitamins like B vitamins, vitamin E, vitamin C, which are considered antioxidants. There's arginine in there, which helps with overall blood flow, circulation, and then omega-3 fatty acids, which I know we're probably going to talk about a little bit later when it comes to joint health, but that's also added into Bright Mind 7 Plus too. So it's not just the MCTs, it's all the other nutrients as well that create this optimal formulation that's also palatable.
Okay. And you mentioned earlier about age 6 that the changes start happening in the brain. Are you recommending that we start this at age 6?
So what I would recommend, because Bright Mind, so technically, and this is like a learning opportunity for everybody, technically by the age of 7, our pets are considered senior citizens. And I know that's kind of a tough pill to swallow, especially if you had, a dog in your household like me. I had a Pomeranian that lived to be 18 years of age. By age 7, there was no difference, in his external display of activity in comparison to when he was 1 year old. So, age 7 is technically when they become seniors. At age 6, we just know from an internal standpoint that the changes are already starting to take place. And so I wouldn't say that you would necessarily have to start a senior formula at age 6, but just know that that is the year of the transition. Start wrapping your mind around the fact that your baby is going to go from being just considered an adult to the senior, to the geriatric years in just 1 year. So that's just a really good transition period.
And what about with the large versus small dogs? Is there a difference in the aging brain? Because the small breeds are living so much longer? Are they considered senior at a later age, or are they at 7 as well?
So that's a really good question. So what we know about small dogs versus large dogs, right? If we're going to have a little bit of a mashup here, small dogs, you've already mentioned, have a tendency to live longer. So we are actually able to kind of recognize, senior related or age related changes in them over more of a gradual period of time because they have more time, with us. With our larger breed, just because I feel like there's a lot of differences as far as just, first of all, their size, their metabolism, what's going on from an internal standpoint, they do have a tendency to show their age a bit more quickly, but it also falls under the category that their age duration tends to be a bit shorter than our larger guys. Now, our smaller guys, excuse me. Now, I will say this, over the years of practice, so I've been out practicing for over a decade. From when I started, even before I went to vet school and when I was starting off as a veterinary technician to when I became a fully grown vet, right? I have seen the general or the average age of my patients continue to go up, and up. And that's even with large breed dogs. So typically before, like 10 years ago, if I saw a 12-year-old large breed dog, it would be like, wow, you are at the end of your life, my friend. But now I'm having large breed dogs that come in, for different reasons that are at age 14, age 16. So and I think there's multiple reasons for this. I think that as pet parents, we're feeding a little bit differently. We're paying closer attention to the ingredients that are going into our pet's food bowl. I think that pet parents are also following the recommendations from veterinarians a bit more closely. And so there's just a lot of different factors with that. So yes, back to your original point, small breeds versus large breeds. Small breeds do have a tendency to live longer versus large breeds. But in general, the good news is I'm seeing all of my doggy patients just live longer.
When we're feeding the Bright Mind formula, about how long is it going to take until we start seeing changes happening with them to know of if does this food actually work?
Yeah, so this is also kind of a variable situation because, again, with Bright Mind 7 Plus, the intent is for the otherwise healthy aging pet, right? So we know, again, internally, there are changes that are happening at the level of the brain, but maybe externally, they're not really showing much of a difference, but you want to go ahead and be proactive and start them on a formula that's going to promote that mental sharpness and that overall improvement with attention. And so based upon the study, the recommendation is for them to at least be on this diet for 30 days before you can say, all right, I'm not really seeing a difference. And here's the thing, you may not see an obvious difference because they're otherwise healthy. Maybe what you're going to recognize is, wow, we're still able to take these walks. We're still able to play, brain games at the age of 12, 13, versus if you hadn't started Bright Mind 7 Plus, your activity involvement may feel a little bit different.
Okay. Yeah, because in the bird dog world, we are still running dogs in national championships. It's not unheard of to have a 10-year-old dog, that hasn't slowed down. And so,
absolutely.
yeah, I think in that kind of a dog, when they're so active, you wouldn't necessarily see the change as you would if, versus the dog that's kind of turning into a couch potato and already kind of showing signs of aging, to see them turn around.
And like the aging process can also vary too. So, and this is something that I love sharing with my clients as well, that when our pets age, it can be difficult for us to recognize immediately what's going on. I think one of the first telltale signs with aging pets is their decrease in activity. But is that related to their, cognitive health, or is that related to joints? Is that related, to a disinterest? Is it just related into, maybe their interests have changed, along the way? So it can be really difficult to pinpoint, okay, when is the exact day where I noticed that my pet started to show signs of cognitive decline or a change, related to cognition based upon their age. It can be very challenging.
Right. Yeah. I remember having a conversation with a woman that had a 13-year-old corgi, and she said the dog would just kind of sit in the corner and not really do much. And she switched the formula to Bright Mind, and a couple weeks later had started playing with toys again and hadn't touched a toy in over 2 years.
Yep. Yeah. So, these are the stories that we hear almost on a daily basis. Now,
right.
I will say this, and we're going to get to this at some point, but I wanted to mention this because this is something I feel like is really important when we're talking about Bright Mind 7 Plus. And then let's say there's another diet out there that maybe your listeners have been made aware of called NeuroCare, right? Mm-hmm. Yep. NeuroCare, which is a therapeutic diet. So it's still a Purina diet, but it's a diet that requires a prescription, right? Because in order for your veterinarian to prescribe it, there has to be a diagnosis of something going on or a suspicion of something going on to require the use of NeuroCare. When I have my older patients that come in for just regular exams, and then my client says, oh, by the way, I feel like, since my dog is 7 years or older, I want to try to do something that's going to help promote, improvement in his senior years. That's when I'm going to say Bright Mind 7 Plus is probably the right choice. If I have that same client that comes in with an older dog and says, hey, doc, I've made this appointment because my dog is staring off into space, or is using the bathroom in the house. Maybe the sleep-wake cycle is interrupted, so he's sleeping by day and staying up at night. Then I'm going to start to think, all right, this is beyond just normal age-related changes with the brain. We may actually be in the category of cognitive dysfunction syndrome, also known as CDS. And if I feel strongly that that is the diagnosis or the tentative diagnosis that I'm making for my pet or for my patient, then I'm probably going to recommend NeuroCare over Bright Mind 7 Plus for those particular patients.
Okay. When it's more extreme like that.
When it's more extreme, that's right. Because remember, Bright Mind 7 Plus, it has the brain supporting nutrients, it has the MCTs or the medium chain triglycerides in it, but it's really for that otherwise healthy aging pet. NeuroCare, which is the veterinary prescribed diet, it also has brain supporting nutrients. It also has the MCTs in it, but it's at a higher amount. And so that is going to be for the ones where I am concerned of cognitive dysfunction syndrome, also known as CDS, also known as doggy dementia. And there can be a little bit of a fine line there too.
Okay. What about for our active bird dogs that we're still out hunting with, competing with? And because the Bright Mind formula is a 29% protein and 14% fat, correct?
Yep.
Okay.
Depends on which one, right? So yes, Bright Mind 7 Plus actually depends on if you're feeding like the chicken and rice formula, it's at 32% protein and 17% fat as fed.
Okay. So is it varying between small breed and large breed? And then
yes, so there's going to be a little bit of variation between the formula as far as small breed versus just adult meat, just the adult 7 Plus maintenance. Also too, there's going to be a little bit of variation if we're talking about the wet formula versus the dry formula. So, I mean, when you're looking at those numbers, something that I want to just encourage your listeners to be aware of is that those variations don't really mean a whole lot. It's still within a minimum and a maximum that's put forth as far as the guidelines are concerned from AAFCO when we're talking about support or optimal nutrient support for these pets at a certain life stage. So if it's off by 1%, it's not going to make or break the scenario.
Right. Okay. That makes sense. So when I'm changing my active hunting dog, which I have them all on the Sport 30/20. So when I'm moving down a little bit to make those changes, for the senior dog to go to Bright Mind. And I'm seeing a little bit of weight come off, especially during hunting season. Are you recommending, can we mix it? Can we mix the Bright Mind and Sport together?
So this is also such a good question. And I get asked this so many times too, because it's almost like if I can make a combination diet, right? If I could take a little bit of all these amazing diets and package it up into just one formula, that would be the catch-all for our patients. And unfortunately, it's very difficult to do that. So when I have clients that ask me about mixing certain diets, my number one response is it's not going to hurt, but I can't guarantee that it's going to help at the same level as it would help if you're feeding one independently. You think about, all right, if you have an average sized dog that's taking 2 cups per feeding, right, of whatever you're feeding them, if you are doing that based upon the feeding guidelines or the manufacturer recommendations, based upon what Purina is encouraging you to do because of the nutrient composition, if you start to half those amounts based upon their weight, then we just can't guarantee that your pet is going to get enough of the MCTs in that reduced amount that's going to be of maximum impact for cognitive health. And we can't guarantee that it's going to get the appropriate amount of the omega-3 fatty acids if you are mixing it like that. And so for those scenarios, this is something that I always say, pick your poison or prioritize. So I look at my pet or I look at my patient and I say, all right, what am I trying to target? Like what is at the top of the list as far as priorities are concerned? If I have an otherwise healthy, a dog that is still out there running, then let's continue on 30/20. Let's continue on the Sport, and just continue to monitor for any changes that may be associated with cognitive health and then make that transition. There's also the ability to provide nutraceuticals. So let's say, you have a senior pet that maybe runs a lot. Maybe you want to go ahead and put them on a senior formula that's going to target cognitive health like Bright Mind 7 Plus, but you're also worried about their joints. Then you might want to transition them to Bright Mind 7 Plus, but add in a nutraceutical like some more omega-3 fatty acids. I know many of you guys have probably heard of Dasaquin, just as a nutraceutical that can be supportive for joints. For my senior girl in my house, I have her on additional fish oil from Nordic Naturals. So there's different ways to manifest what you're looking for without having to mix the diets per se.
Okay. Yeah, I feel like when our dogs turn that 7-8 years old, we are automatically putting them on Bright Mind and adding Dasaquin into it. For that joint support because they are still working or running almost every day.
Now, Bright Mind 7 Plus, I want to point out, it does contain some omega-3s, omega-6 fatty acids. So there is a little bit of support in there. And also Bright Mind 7 Plus contains a natural source of glucosamine too. So there's a little bit of support, but certainly for the group of dogs that you're describing where, they're not couch potatoes like my dogs, you may need some additional support. My dogs aren't running after anything. Okay. So maybe they're running to their food bowl at best, but that's pretty much it. But certainly, with your working dogs or your hunting dogs, you have to pay a little bit closer attention to added support for their joints and for their overall energy as well.
Okay. And, what about, the veterinary formula, the JM for the joint support, so then we get into that as well. So when they are aging and we see them slowing down, again, are you thinking it's probably not best to mix the JM with the Bright Mind, just pick one or the other?
Yeah, so that's kind of the same conundrum that we're all in, right? And so JM I love because it has so much of those omega-3 fatty acids, which are so beneficial from an anti-inflammatory standpoint when it comes to overall joint health. There's been amazing studies to support the use of JM post TPLO surgeries, when you have patients that you're diagnosing with osteoarthritis. It's great as just being proactive for my larger breed, dogs that I know are super active. So I can't say enough great things about JM, but it is going to be difficult to provide, both JM and Bright Mind 7 Plus in the right amounts where you're going to have maximum impact. Now, the reality of the situation, if people are splitting it up and mixing it, it's not going to hurt. I don't feel at all that it's going to, be contraindicated or have any type of negative effect. I just can't guarantee, based upon the studies, based upon the research, based upon the amounts of all these important nutrients that are going into either of these diets, I just can't guarantee that they're going to get optimal or maximum impact if they're feeding both at the same time.
Thank you for explaining that. Because
it comes up so often, and and it's always so tough because I feel like we're constantly playing that balancing act game with these patients or these pets, especially as they age. And so I always say, take a step back, really evaluate your pet. I know that we all want to do like 120% what is the best, for my dog, in his or her scenario. And whatever you're doing, by just targeting, whether they're turning, they're senior, whether you're targeting their joints, you are doing a great job. And you may have to bend and change too along the way. So you might say, all right, up to age 13, JM has been my jam. It's been beneficial. It's been helpful. But now let's really focus on some brain support. And then that's when you make that transition.
What about sustainability of the Bright Mind? Is that something that the dogs need to stay on in order to continue to gain the benefits from it?
Yeah, for sure. So Bright Mind 7 Plus, it definitely is not going to be where you give, a short duration of it and then it's going to continue to provide benefits and support. They absolutely need to stay on it on a day-to-day basis. Now, if you miss out on a day or two, it's not going to rock the boat that much, but this is certainly something where you want them to be on it long-term.
The options on the market for the Bright Mind 7 Plus is chicken and rice, and then also in the large breed and the small breed formula. In wet food, it comes in turkey and brown rice or the beef and brown rice. So, I hear a lot of people say, well, my dog has a sensitivity or an allergy to chicken. So that takes out the dry food option, right?
Yes. So these are always tough too. I always start with asking, are we sure that we're sensitive to chicken? I feel like sometimes chicken is like the number one besides corn, which is a whole other conversation.
Right.
But sometimes we pick on chicken quite a bit and say, oh, my dog is allergic to chicken without truly going through the test or the evaluations to ensure that that's what they're truly allergic to. Now, if they are allergic to chicken through trial and error, you fed it, they break out, things take place where you're like, I'm pretty sure it's the chicken, right? Then unfortunately, Bright Mind 7 Plus, it does contain, not just chicken, but other poultry, poultry in general. And so I would say we would have to hold off on feeding Bright Mind 7 Plus as is right now if you do have a patient or a pet that is allergic to chicken. Now, you had mentioned the wet formulas. So the beef and rice formula, it is primarily beef, but there's still going to be some poultry byproduct. And so what I would say about that, certainly have your listeners work with their veterinarians. If they're not sure if their dog is truly allergic to chicken, that might be a formula that I would challenge them with. Because chicken's not listed as the first ingredient. It's, a smaller amount of it. Beef is the primary. So that would be one that would be kind of my segue to see, all right, are you going to have a response to this or not? But we don't have it in a hydrolyzed form yet. There have been some talks about maybe providing some additional flavors or additional protein options for Bright Mind 7 Plus in the future. But currently, as it stands, that's what we have available.
Okay. And the wet food formulas, are those a complete and balanced diet as well?
Yes.
Or is it, okay.
Yes, they are.
So people can feed that 100% then?
Absolutely. And in fact, with my really old, finicky, I won't touch dry food, even if you wrap it up in a nice package, for those patients, I automatically will tell, my clients, just don't even mess with the dry food. Just give them those tubs of the Bright Mind 7 Plus. It is complete and balanced. And that is substantiated with that AFCO statement that's listed on the packaging. And so that's how your listeners can ensure that it is complete and balanced. It will say it.
Okay. So this is kind of off topic, but can you touch on with the wet food? I always think if they're going to eat wet food, you're going to have more dental issues, of more tartar on the teeth because you don't have the dry kibble breaking that up. And in general, I give my dogs a handful of the DH, just put it in their food because I feel like that's the equivalent of them brushing their teeth twice a day when I'm feeding them.
Yeah, perfect.
But
so there's been a lot of I don't want to say conflicting information, but yes, depends on which veterinarian or which expert or whomever you speak to. Some of us are going to feel pretty strongly that try to keep your pets on a dry formula to help with the reduction of tartar, where others are going to say, you know what, I haven't really seen enough evidence to support that. It's also going to be some variability with the breed, the type of dog that you have. I am the proud mother of very small dogs, okay? Small dogs are also known as ankle biters. They have a tendency to develop dental disease rapidly, and they're always on a dry formula. So I still have to make sure that they're getting their regular dentals, making sure that I'm providing some other intervention to help get rid of the tartar and prevent gingivitis and overall dental disease. Whereas larger breed dogs, just based upon how much space they have in their mouths and, they're just different, right? They have a tendency to maybe not develop dental disease as rapidly as smaller breeds. So it is going to be variable from breed to breed, from dog to dog. With that being said, my rule of thumb, I like exactly what you've mentioned. I love my dental diet, specifically like Purina DH. If I have a pet or a patient that is more predisposed to dental disease, I'm probably just going to recommend that they eat that diet or add it in kind of as needed for the crunchiness to see if that helps reduce it as well. But then ultimately, none of this can truly replace the intervention of a proper dental done by your veterinarian if you are starting to see that tartar build up, the redness along that gum line, any sense of oral pain. All of these guys truly need to be seen by a vet to have a medical intervention take place.
So getting into the NeuroCare, we kind of touched on that a little bit earlier. And I guess when I had first heard about NeuroCare, it was when I was feeding the dog I was talking about earlier, the Bright Mind. And then I was sitting in a conference of the Canine Health Foundation when there was a presenter talking about this new food coming on that was going to be therapeutic for the CDS and the epilepsy. And I thought, and this was when I already knew my dog's seizures had gone away. And so I thought there's got to be something more to this food. And then that's when I learned about the NeuroCare. And my explanation of it to people is that it's basically a jacked up form of Bright Mind.
That's a great place to start. Yeah.
but it is. And I know there's no claims of it's going to cure anything because just like all the veterinary diets, it's a therapeutic
That's right.
Diet. So
That's right.
Can you talk a little bit more about the NeuroCare and how it's going to be similar or different from the Bright Mind?
Yeah. So there's so many things I want to unpack with just what you just said, including going back to your own pet. But let's first start with the differences. So Bright Mind 7 Plus is considered a senior formula. So not only does it have the addition of the MCTs to it, it also has brain supporting nutrients that I mentioned, like your omega-3 fatty acids, your antioxidants, and your vitamins, right, to support just the aging brain, right? But then it's also, because it's considered a senior formula, it's going to have more optimal amounts of protein and fat, so be a little bit more calorically dense to try and support those aging pets. With NeuroCare, it's indicated for growth and adult maintenance. So totally different life stage. So because you had mentioned that one of the indications for NeuroCare is idiopathic epilepsy, also known as seizures of unknown origin, many of my patients that develop seizures, they develop it at a younger age. And so with NeuroCare, we had to make sure that it was a formula that was going to be appropriate for that particular life stage as well. So that's one difference I want to point out. Another difference between the two formulas is that the amounts of the medium chain triglycerides, or the MCTs, are different. You said it perfect by saying that NeuroCare is a bit more of a jacked up version of like Bright Mind 7 Plus, but there's some truth to that. The percentage of MCTs in NeuroCare higher than the percentage of MCTs in Bright Mind 7 Plus. And so that's why when I'm making the decision with my senior pets where I'm concerned of cognitive dysfunction syndrome versus, okay, we just have the healthy aging pet on the other side, that's when I say, all right, this is my differing factor. I'm going to go with NeuroCare because this patient is coming in with symptoms associated with CDS too, okay? Also too, Bright Mind 7 Plus has that added natural source of glucosamine. So again, falling under that senior formula, thinking about their joints. So we're gonna put a little bit more of a target into that, whereas NeuroCare, because it's indicated for growth and adult maintenance, it's not gonna have that added source of glucosamine. Now, where it gets confusing, it doesn't mean that you can't feed NeuroCare to your senior dog that has cognitive dysfunction syndrome, in which that's what it's indicated for. So what I mean by that, even though it's indicated for growth and adult maintenance, it's still considered an appropriate diet for what you would consider a senior pet, but just more specifically for those senior pets that have the concerns of having CDS. Okay, Bright Mind 7 Plus, it's your senior formula because of all the added or the benefits that I mentioned before, on top of having the addition of those MCTs at a lesser amount than the NeuroCare. I hope that helped explain it.
Yeah, it does. And again, I come across the concern with how yucky MCTs actually taste. So
yeah,
when that's been increased so much, is the palatability still good at this level with the NeuroCare?
Absolutely. So the increase, when you're looking at the amount, so it's only by 1 percentage point, which you would say, all right, well, how does that make a difference? When you're talking about percentages and talking about something as purified like MCT oil that's added into these diets, that 1% truly makes a difference. And that's what we were looking at in the actual CDS study, the cognitive dysfunction syndrome study that was done with NeuroCare versus the studies that were done leading up to Bright Mind 7 Plus. There was a difference in the amount of MCTs that were put in those test diets. And so with that being said, it's not like it has quadrupled in the amount. So when you're talking about palatability, the palatability is very similar from NeuroCare to Bright Mind 7 Plus. What I will say, where Bright Mind 7 Plus can be a bit more helpful is because it does come in that wet formulation. So again, if I have that senior finicky eater where I'm having to make the decision, all right, which diet am I going to put them on? I really want them to get MCTs. I actually want them to get more of the MCTs that are added in NeuroCare, but maybe he doesn't have a lot of teeth. Maybe he just doesn't want to eat the dry food. That's when I will reach for Bright Mind 7 Plus's wet formula as an alternate option.
Okay.
Now, you had mentioned that you had seen an improvement with your own dog with the seizures. And so I wanted to touch on that a little bit too, because I want to make sure everybody's crystal clear. Bright Mind 7 Plus is not indicated for pets with idiopathic epilepsy or seizures, okay? Now, why that may have been beneficial for your guy is because it did have the medium chain triglycerides added to it. It's still not at the same level as what was in NeuroCare, but it may have been enough to provide some support. And so I'm very cautious when I'm talking about, when I have, veterinarians will ask, well, if my client can't afford, a therapeutic diet, can I just have them go purchase the Bright Mind 7 Plus? Of course, if that's our only option, for sure, start them on Bright Mind 7 Plus. But you have to be really careful too, because I mentioned Bright Mind 7 Plus is a senior formula. If I have a 1-year-old Labrador Retriever, right, because they're the poster children for idiopathic epilepsy, if I have, a 1-year-old Labrador Retriever that comes in with seizures, I still want them to be on a diet that's indicated for growth as well as adult maintenance. So it's going to be a little bit different in that nutrient composition. So I may not be as quick to say, go put them on Bright Mind 7 Plus. I feel like NeuroCare is going to be the better option. Plus, NeuroCare is the only one that's been truly tested for its benefits on idiopathic epilepsy. Bright Mind 7 Plus hasn't.
Yeah.
So I just wanted to make sure that everyone's clear on that.
Yeah. And thanks for touching on that too, because, I have had that question in the past as well of putting the younger dogs on Bright Mind because people see, the ones that have tried it with their senior dogs and they see the great change.
Right.
And so they ask about being able to use that 7 Plus on the younger dogs just to have that. But you're right. You miss the growth phases and the importance of at the younger age.
That's right.
Thanks for touching on all this. I mean, these bird dogs give us their all for their entire lifetime. And the fact that ProPlan has a diet like this that will help us give back to our dogs in such a positive and beneficial way that improves their life, in their last, those last years with us is, something that we can give to our dogs that we haven't had the option of in the past. And a lot of times our dogs don't want to slow down.
Right.
It's
such a tough scenario to be in. You had mentioned your own pet. I think the reason why you have such, an affinity to Bright Mind 7 Plus is because you've seen that it works. And I have a very similar experience with my 18-year-old Pomeranian that has since then, crossed that rainbow bridge. But he's a story. He's a case that I use with my vet students and with other veterinarians all the time, where if it hadn't been for Bright Mind 7 Plus, this was before NeuroCare was even available, I truly don't think I would have had as many of the good years as I had with him. So I'm very grateful, for the opportunity he was able to be, don't really want to call him a groomsman, but he walked in my wedding. So, and I don't think that he would have been able to do that had it not been, with the innovations, of Bright Mind keeping him mentally sharp.
Right. Right. And I think we've all seen the Bright Mind commercial on
Yes.
TV, and it makes us all cry. And
I
I
mean,
even went to
every
the
time.
yes. And I even went to the marketing team and I'm like, was this legit or is this like a paid actor? Because I
Yes.
need to know for my heart. And they're like, no,
Right.
that's a real story. And I'm like, oh my gosh, now I'm gonna continue to cry every time I see it.
I know it, but it truly does speak to that human animal bond. And one of the
Yes.
reasons why, you have listeners for this podcast, one of the reasons why I have clients, one of the reasons why you and I do what we do for such a great company like Purina, there's just so much importance with that bond, the human animal bond. There's a mutually beneficial relationship that takes place. And even as these patients or pets get older, you want that relationship to stay the same for as long as you can.
Right. Right. I just think, and I know I've said this 100 times, but the fact that we can improve their lives on a daily basis by just what we are feeding them
That's right.
is truly amazing thing.
Yes.
So yeah, thank you for sharing it with the listeners today.
Absolutely. It's been my pleasure. Thanks for
Yeah.
having me. This is such a cool podcast and such a great
fun.
concept. Yeah, I love it. So I just think the name of it's really cool. The Bird Dog Babe. I was like, man, I get to come on the Bird Dog Babe. I feel very important and very special. So I do appreciate you having me on here. And I'm certainly available. If there's any follow-up questions that come about, I'm more than happy to provide any additional information.
Perfect. I appreciate that a lot. So what about, I want to touch on one more thing because I always want to know what's coming on next. I feel like Purina's always in the works of something new and amazing.
Always.
And like the new one that they just came out with cats, of people that are allergic to cats, and you can oh my, and so now they're not allergic to cats because of, putting this, it's just amazing to me.
It's amazing. And that's actually something I wanted to share with your listeners. So there is a new product out there. It's over the counter. So it's a Pro Plan diet that you can go into and purchase without a prescription, but it's called Live Clear. And you already mentioned it. It's our novel approach to reduction of feline allergens. And so for those of us, I'm raising my hand even though you can't see me, those of us that have had sensitivities to cats, imagine that as a veterinarian being sensitive to cats, we have suffered for so many years. And as a result of that, I've only been able to foster kittens, foster adult cats for a short amount of time, but I've never been able to actually have a cat, full time because of my sensitivity to them. And so this breakthrough, innovation that has taken place provides, an opportunity to reduce my response to this feline allergen that's being produced by cats. And so it is revolutionary. It is already changing the lives of those who have tried this particular product. It is a complete and balanced diet for your cats. And so they could care less about what they're eating. They're actually quite happy about it, but it's utilizing this novel approach of an antibody. So it's a very specific antibody against one of the more prominent feline allergens. And so when the cat is eating the food, it actually works on the spot in the oral cavity to reduce that amount of that feline allergen that's being emitted. And so when you think about cats and how they maneuver in their households, they lick themselves, they do a lot of grooming, then their fur goes out into the environment, and that fur is what contains that allergen. And so if you can already have impact in the oral cavity to where you're reducing that amount, we've seen and heard some really great responses to this. Plus, there's been some great efficacy studies and trials that were done even before this particular product hit the shelves. So it's amazing.
That's crazy.
Stuff.
Yeah, that's crazy incredible. And my husband always uses the line that he's allergic to cats, and that's the reason why I can't get one. And so
now put your money where your mouth is.
Right. Right. And I've been thinking for the last year here, I'm like, well, if I get a hairless cat, we're not going to have an issue. But I mean, this new innovation with Purina, I might be able to go get a hairy one now.
And it's true. And even with the hairless cats, so even with those guys, because I am a huge Sphinx lover, even with the hairless cats, this prominent allergen, it's called FeLD1. It actually is produced in the saliva in the greatest amount. And then it's produced in the sebaceous glands. And so even without hair, right, they can still produce this particular allergen that you're going to be sensitive to. So even for the hairless cats, even for the ones where people are like, well, I shouldn't be sensitive to this particular pet, this product helps with them as well.
Okay. Wow.
Yeah, I know. It's crazy.
This is very exciting.
You can get a hairless cat and a long-haired cat. You're welcome.
He's going to listen to this and go, no. So I also wanted to touch on right now when I'm going into the store, I'm seeing all the new packaging with Purina.
Yes.
And I'm also hearing a lot of feedback from people that know that, that they can ask me their questions about anything ProPlan and I'll help them with it.
Yeah.
So I'm getting pictures of bags. Is this the one that I normally feed?
Yeah.
Is this it's the same one? But I also feel like there's a little bit of a placebo effect because I'm hearing of, well, the sport formula must have changed because the bag has changed. And so can you touch a little bit on that and try to ease some listeners?
Yes, absolutely. So your listeners have already been made aware that there has been some new packaging that's taken place with our ProPlan line. And the whole point of this is to create more of a streamlined approach to picking the right product for your pet. And so just the way that things are going to be categorized, it's just going to make so much more sense when you go in there and you can feel more confident that you do ultimately have the right food for your pet based upon their life stage and their specific needs. Now, there are some optimizations to the formulas that either have been made or will be made, so stay tuned to that. But as far as like any true formula changes to where you're like, this is so different, my pet is acting different, that is probably associated with the change in the packaging. Any changes that have been made are only going to be for the benefit of the pet.
Okay. Thank you for touching on that.
Absolutely. And so they're rolling this out in different stores. And so don't be alarmed for you guys who are listening. If you go in and you see maybe some of the old packaging mixed in with the new packaging, there's going to be a little bit of a transition period before you just see the only the new packaging left over. But if you ever have questions about, do I have the right product? Is this what I need to be feeding? Have there been any changes with the formula? The number on the back of the bag, the 1-800 number, is your best friend. So always feel free to give us a call and to figure that out. Also, too, I'll provide some websites for more information, Courtney, that you can put into your notes. And these are really good places for your listeners to go to if they ever have a question about packaging or ingredients or what's in the pipeline, who do I reach out to? So I'll provide those websites as well.
Perfect. That would be great. Oh, and I heard with the packaging as well. So because there's two different languages on the bags now, so that's been confusing people. But is the purpose of it, when you're streamlining it, is it not so if you go to another country that the bags are going to be the same, they're going to be uniform everywhere you go?
Yeah, I think that's the hope. That's the goal.
Okay.
Now there's different rules and regulations depending on which country you talk to. And so packaging may not be the same across the board in every single country where Purina is sold, but that is absolutely their approach, is just to make it more streamlined and easier, for your listeners to recognize, okay, this is what I'm supposed to be feeding or what I have been feeding in the past.
Okay.
And also to the labeling, like I want to make sure, this is something that I'm always coaching my clients on as well. Like I know we get caught up in, that sleek look and the cute little dog or cat that's placed, or pictured on the packaging, but the words are also really helpful too. So don't be afraid to read, it's going to say things like, adult maintenance or senior or puppy, or what they'll also refer to as development. So there are going to be some key words on the packaging that will also lead you in the right direction to ensure that you are providing the appropriate product.
Right. And I do think it's important there to read and understand what it is you're feeding the dog, because I can't tell you how many times I ask people, well, which formula you're feeding? And they'll say, it's the purple bag.
I know. Don't be like my husband. That's how he is with everything. That's how he describes everything. It's that blue and white, bag. I'm like, there are a lot of blue and white out there. You're going to have to be a little bit more specific.
Yeah.
But with that being said, I think just human nature, we're just drawn by stuff that we recognize really quickly and really easily. And so at some point it will become very intuitive as we roll out this new packaging. But again, the wording on it is also going to be easier for you to see, easier for you to understand, more of the words that makes sense. Like, okay, yes, I know this is the right formula. So again, I think that ultimately it's going to be a lot easier for all of us.
Yeah. Nope, it's perfect. And I love the looks of the new packaging as well. It's beautiful.
Me too. I had seen it first. So you had mentioned Westminster. I typically will go to Westminster every year. I provide support for the marketing team. I'm usually the one under the Meet the Expert sign, and so people can come and ask me questions, and usually they show me really cute pictures of their pets. But anyways, with that, this past Westminster was when they had rolled out that new packaging, or at least started to showcase, okay, what's to come, and I was really impressed back then.
Yeah, it's beautiful. On a finishing note, what's a good website for people to go to find more information about ProPlan?
Yeah, so I like www.purina.com/pro-plan. Also, too, another one is www.proplanvetdirect.com. You guys may have some experience with this, but that is your online store where you can order any of the Pro Plans or the veterinary diet, but typically it's going to be connected to your vet practice. So certainly talk to your veterinarian about that. And then another website that I want to share with you guys is just the non-denominational nutritional guideline website, which is www.wasava.org. Wasava is WSAVA.org. And you and I had talked about that at the beginning of the podcast, but that's a really great source for just general nutritional recommendations and guidelines for the pet loving community.
Perfect. Thank you so much, Dr. Callie.
You're
I really
so
appreciate
welcome.
all your time and info. So
yeah, absolutely.
A great learning experience. Even though I knew a lot of it, you taught me quite a bit. So
it's always nice to chat it up. And like I said, I really appreciate being included in this podcast. And for the rest of you, I don't know if it's hunting season. Has it started?
It is. Yep. September 1st. Well, for season. Some of us. Yeah.
Yes. Happy hunting season. And keep up the good work. Yeah.
Thanks for listening to another episode of the Bird Dog Babe podcast. If you enjoyed this episode and learned something from the content, please share it with your friends. Please subscribe, rate, and review this podcast on whichever platform you're listening from. Check out the show notes for links to references from this episode, as well as info on how to connect through Facebook, Instagram, and YouTube. If you're loving this podcast and want to support the production and content, please consider becoming one of my Patreon patrons. Being a patron connects us more on a personal level, where I'm able to help answer questions and give advice. My husband William and I have bred, owned, and trained AKC Master Hunters, Field Champions, NAVDA VCs, and AKC Show Champions. We're excited to not only share what we've learned, but also listen from previous and future episode guests for additional content. Go to patreon.com/thebirddogbabe and $5 per month and you're in. Through the Patreon platform, 5% is donated towards conservation and an additional 5% is donated to the AKC Canine Health Foundation. Until next week, Bird Dog Babes, keep them versatile.